Hi, everybody. Thank you so much for joining us today. My name is Andrea Decker, and I have the pleasure of representing the Fleet Science Center. Thank you for joining our special lecture series in partnership with the Sanford Burnham Prebys Medical Discovery Institute. It's a partnership that we very much value. They do a lot of fantastic research in San Diego, and it's wonderful that they allow us to highlight all the great work that they're doing in series like this. And we're sure that more series like this are coming in the future, so stay tuned with the Fleet Science Center. If this is your first time with us, thank you for joining us. If you've been here before, welcome back. As you know, we are not fully open yet. The Fleet Center is open though. Yay, I'm very excited to say that we are open. We opened on April 9th, and we're open on a shorter basis. So we're open from Friday through Monday. And we welcome you back. It's going to be very safe. Masks, of course, social distancing. We have an expanded cleaning schedule. So if you're looking for something to do with your family, I hope you will come visit us. The way it's going to work today, we have Dr. Alessandra Sacco joining us today. And once I turn it over to her, she will give us her presentation, and then we will start a Q&A after. As you've seen in my little PowerPoint presentation, you have the opportunity to submit questions through the Q&A function, and that's the two little speech bubbles at the bottom of your screen. If you click that, you can submit questions, and you can submit those questions at any time. You don't have to wait until we get to the Q&A period. I encourage you to put it into the Q&A whenever the question pops into your head, so you don't forget it. And both Dr. Sacco and I will keep an eye on those questions, and we will, if there's something that we can answer in between, we will, but in general, we wait until the Q&A to answer the questions. Also during the Q&A, I will launch a poll. It's kind of our little audience survey. If you wouldn't mind taking a second filling that out while you listen to the Q&A and get all the wonderful answers to the questions that we're getting, that will be wonderful. You know, as a science center, it's all about data, and we love hearing from you so we can make sure that we offer the best programs to you that we can. And I think that's about it. Oh, yes, this talk is being recorded. As you might have seen popping up. And we will make that available on the Fleet Science Center YouTube channel in about 2 weeks, I think, is when we will open that up for everybody to see. But I'm still glad that you are here in person, because as much fun as it is to be able to watch the video on your own time, you don't have the opportunity of asking questions. And also, we appreciate you being here, not only for your interest in science, and especially science in San Diego, but also for supporting the Fleet Science Center. We've been closed for a full year. It's been a rough year for us and our employees, and any ticket purchase certainly helps to keep us going and bringing science to everyone in San Diego County. All right, with that, Dr. Sacco, I'm going to turn it over to you. So take it away. Thank you so much for joining us today. We're so excited to have you.
Thank you so much for the introduction, and I'm very happy to be here. So I'm going to start sharing. Let's see if everything works properly. And can you see it? Perfect. Perfect. So welcome everyone. Again, it's a pleasure to be here and to be part of this seminar series. And I am just a little bit about me. I'm a biologist. I studied in Italy, in Rome. And I've been here in California for about 20 years now, and studying skeletal muscle. And today I will discuss with you skeletal muscle aging. So what happens when we age to our muscles, and what can we do to actually prevent like the defects and the alteration that occurs in muscle. So aging, I mean, who has been who attended the previous seminars in this series, so aging is defined as a progressive decline in tissue function. And this happens in all of our tissues. And this is the results of two aspects. One is the accumulation of damage in our tissues. So the inability of the tissue to actually repair like the damage that is there, and also impaired tissue regeneration. And I think many of us are familiar. I mean, if we injure ourselves, even like just even a cut or a scratch, it takes us much longer as we age to repair it than what it took when we were 20 years old. So significantly, we progressively lose our ability to repair our tissues, and it contributes to the impaired tissue function. Now, skeletal muscle is a beautiful tissue that actually is devoted to fundamental function in our body. So it's essential for our voluntary movements, like walking or raising, like our arms, for example, for breathing through our diaphragm muscle and the trunk muscles, to maintain our posture, so to be able to stand straight, and also it has a very important function in organ metabolism, because the muscle communicates with other distant organs, like for example the liver, and really contributes to regulating the metabolism of the body. And it's also very important in maintaining body temperature. So you can imagine with this fundamental function exerted by skeletal muscle that when it's actually impaired, we have significant problems in our bodies. So here I want to just to go over like one main aspect. So skeletal muscle is affected in several clinical conditions, and they range from primary defects of the muscle, like for example, muscular dystrophies, where the muscle cells per se are affected, to secondary diseases of the muscle. So conditions in which other tissues are affected, but as a result, the muscle is affected as well. And you can see here, I put some example, like inflammatory myopathies, when we have excessive inflammation of the muscle, so like blood cells coming into the muscle, or defects in the innervation, so the connection between the nerve and the muscle that is essential to actually send the signal from our brain to the muscle to move it. And as a result of these alterations, of course, then we can no longer move some of our muscles. Now, there are also other conditions in which skeletal muscle is affected. So in several types of cancer, cancer patient can exhibit what is called cachexia, which is just a term to define like severe skeletal muscle loss. And that's something that is also significantly contribute to the poor survival in such conditions of cancer. Muscle is also affected in conditions of inflammation, of infection, like HIV, for example, or sepsis, when we have systemic inflammation of our bodies. But also in conditions like such alcohol or drug abuse, there is an effect on skeletal muscle. And this is due to altered nutrition, but also defects in metabolism of the body. And also maybe most familiar we are with this one, like with immobilization. So if we break a bone and then we need to have a cast for several days, several weeks, when we remove the cast, what we will see is that our muscle shrunk. So it's much smaller because we didn't use it during that time. So really muscle is one of those tissues that use it or lose it. You need to maintain it active in order to maintain the mass. And another example of immobilization or reduced activity of the muscle, the results in reduced muscle mass is, for example, what astronauts experience out of space in conditions where there is reduced gravity. So they use less their muscles, and when they come back, they have like muscle atrophy. And then the topic of today's seminar is what happens during aging, so sarcopenia, so loss of muscle mass associated with aging. One important aspect is that regardless if it's a primary disease of the muscle or a secondary disease of the muscle, the loss of muscle mass and strength correlates with poor survival in many of these conditions, really indicating that whatever affects muscle to a significant degree is going to impact like both quality of life, but also the overall survival of patients. So it's quite important to maintain a healthy muscle in a variety of contexts. And again, today we will focus on aging. So what happens to our muscle when we age? I put here this term, sarcopenia, that comes from the Greek and literally means poverty of the flesh. So a reduction of the volume of our muscle. So what you can see here is a graph that shows that throughout our life, we undergo progressive loss of muscle mass. And while we might be familiar with the muscle mass loss that we detect like in older years, like over 70 and then until 80, what maybe is less known is that the progressive loss of muscle mass starts very early in life. So our muscle mass peak around 25 or 30 years of age. And then progressively with our life, we actually will have a progressive loss of muscle mass. And so it is quite important to understand why this is happening and what can we do, of course, to counteract, delay, or prevent this from happening. Now, this is just to show basically the rate of decrease in muscle mass that we have. Specific ways to look at muscle mass to visualize it, it's put here. So this is a magnetic resonance imaging, which is an approach, a clinical approach with which you can actually look at, at your tissues. And here, this is work published by Sergi et al. In 2016. Here are images of thigh muscle of a 25-year-old man or a 65-year-old man. Now, in dark, you can see the muscle mass. Here in white here, this is the bone. And what you can see is that the 65-year-old patient has significantly less muscle mass, so the dark areas, but not only, also you start having all these white spots inside the muscle. And these are accumulation of fat deposit or fibrotic scars. And this is telling us like one important aspect, that not only we have a progressive loss of muscle mass, so not only quantity, but also the quality of the muscle changes as we age. And this leads again to a compromised ability of the muscle to contract and then to generate force and so strength. So the end result of this is progressive weakness and limited mobility that can range by variety of degree, by either having problems rising from a chair or climbing stairs or difficulty in walking, and of course also increased risk of falls that is going to, of course, significantly affect the ability of the tissue to maintain itself. And so in more severe cases, this can lead to loss of independence and reduced quality of life, of course. So it's quite important to try to understand how are these changes occurring and what can we do to actually trying to counteract it. And so here you can see main factors that are associated with sarcopenia, so age-associated muscle loss. So during aging, our body undergoes significant changes. And so here you can see that, for example, the level of circulating hormones are actually progressively decrease during aging. For example, the level of testosterone goes down as we age. We change significantly body metabolism. So the way that we actually utilize the energy that comes from the nutrients and from the diet and actually process it for our tissues. We also have progressive inflammation of our tissues. So now we're starting to have inflammation. So cells that come from the circulation that comes in our tissues and so provide signals that normally in young conditions are not there. And so it's altering significantly like the structure of the tissue. And we also have like nutritional changes. And so something to keep in mind. I mean, several of our like nutrients that actually that young life have a certain levels progressively decline. For example, vitamins are or protein levels. And so really like also having a healthy diet is a very important aspect to counteract those changes. And of course, and that's another like aspect that I put here is reduced mobility, which is kind of a catch-22, because as we age, we change our lifestyle. And so we progressively reduce the level of exercise that we do. And this in and of itself is contributing to lowering and decreasing muscle mass. And so we have to be careful as we age to actually be mindful of all these changes that are occurring to counteract like the changes that we have that results in impaired tissue function. So what is the result of all these changes in terms of muscle composition and muscle function? So what you can see here, here are some of the main ones that actually have been observed in aged individuals. So we have it has been observed that we have loss of myofiber. So myofiber is the mature muscle cells that contains all the proteins important for contraction. So we lose number of myofibers, but even the myofibers that remain, they become progressively smaller. So atrophy, like a smaller size of the myofiber. And so that, of course, reduces the force that that muscle can generate. We also have, during aging, a progressive loss of innervation. Now, to move our muscle, like in terms of voluntary movement, we need to send signals like from our brain and through the nerve, like that then arrive to the muscle. If the innervation progressively is lost, that results in disuse of that muscle. And so progressive, then again, atrophy, loss of muscle mass. Another important process that occurs is a reduction in capillary density. So through the bloodstream and capillaries arrive the oxygen and the nutrients that are very important for the muscle then to work properly. So a reduced capillary density results, of course, in a reduced level of energy and oxygen that the muscle can actually utilize. Then I was talking before about quality of the muscle. So, and you saw in that MRI, those white spots, so accumulation of fat and also fibrotic scars. So progressively, what we have is that accumulation of this type of tissues of fat and fibrosis in the muscle, and these are non-contractile. So all of a sudden, in a tissue that is contractile, you have these two tissue types that are no longer able to contract. And so the architecture of the tissue is compromised, and that affects the contractility of the tissue and results in reduced strength. And then, as I mentioned before, reduced regenerative capacity. Like more and more with aging, we are less efficient in repairing our tissues after damage. And I'm going to talk about examples of what are the approaches that are being currently studied in preclinical, so animal models, but also in clinical trials in terms to actually counteract those changes that are occurring during aging. So what you see here is a balance between muscle growth and muscle atrophy. So for muscle growth, in order to have the muscle to grow and to maintain like its size, you need to have protein synthesis. So significant synthesis of the proteins that are important to make muscle. And on the other end, for muscle atrophy, like to induce muscle atrophy, you have degradation of these proteins. And there is a very delicate balance between the two. Now, during aging, this balance is tipped in this direction. So we have an increased protein degradation in the muscle, a decreased protein synthesis. And so that results in progressive muscle loss. So some of the approaches that are being pursued, again, in preclinical and clinical studies is trying to like reestablish this balance and trying to actually promote protein synthesis at the expenses of protein degradation. And I'm putting just some examples here. And in terms of approaches to promote muscle growth are nutritional approaches, like taking protein supplements or taking vitamin D supplementation. And why? Because vitamin D, for example, is one of the vitamins that goes down during aging. So the level go down. And so taking supplementation somehow like counteract like this drop and promote muscle growth. Second aspect, the second approach is the use of androgen. So I mentioned that testosterone and several other hormones, the level goes down in our body with aging. And so supplementation of testosterone is being studied as an approach to actually maintain a healthy muscle. And the same with growth factors like growth hormone or insulin-like growth factor 1. And so these are approaches to restore youthful levels of these components to be able to actually impact muscle health in an age context. Then there is a second approach that trying to actually block protein degradation and really tip the balance with this specific approach. And here you can see anti-catabolic. Now, catabolic is a complex word, but basically means like degradation, right? Degradation of a tissue. And so blocking the degradation of the muscle. And in this case, approaches are like, for example, blocking myostatin. So myostatin is actually a factor that we have in our body that antagonize muscle growth. And so trying to block that as an approach to promote muscle growth. or to inhibit inflammation, like the elevated level of inflammation that we have during aging. And in this case, utilizing TNF-alpha blockers. TNF-alpha is a mediator of the inflammatory response that we have. So again, as you can see here, so within this balance, it's really like the approaches are meant to tip the balance towards muscle growth and to trying to actually reduce like the rate of protein degradation in our muscles to promote maintenance of our tissues and restore muscle strength, which is quite important and is a good indicator like of overall health. So this pertains to really what happens to the mature like muscle cells and like the balance between protein synthesis and degradation. But the second approach, and that's something that we're also particularly interested in, is can we promote tissue repair in aged muscle? Now, I mentioned before that over time during aging, we progressively reduce our ability to repair tissues. And so one approach is trying to understand why does this take place and what can we do to promote tissue repair, and because maybe this could counteract the loss of muscle mass that we see in aging. And to understand this, we need to understand how a tissue is maintained. So here you can see like a tissue, and think that it's muscle, and at any given time, they're going to be cells that die and are going to be lost, and they need to be replaced. And so at any given time, in most of our tissues, we have a population of cells that are called stem cells that are devoted to do exactly that. If there is a loss of a cell or an injury to the tissue, these cells will actually activate, they will start dividing, and ultimately they will replace the dead cells. And so this process is quite effective in at young age, and it happens at several degrees in all of our tissues. But one thing that it's important to remember is that the rate to which this happens is different in different tissues. For example, we might have tissues that actually have a very high turnover, so a very high rate of replenishing these cells. And classical example it's our skin that is continuously replenishing itself, or our blood. We're continuously making new blood cells every day. Then there are tissues that actually have very low ability to, very low turnover and low ability to repair itself. And we can think about the brain or the heart, for example. These are tissues that, if damaged, are very difficult also to repair. And then we have tissues that have intermediate, that actually, they don't have a high turnover, but if there is a stressors, they are able to repair themselves very efficiently. And skeletal muscle falls into this category. So it's relatively stable, but is able to repair itself if there is an injury. So as you can see here, the presence of adult stem cells in our tissues are fundamental to ensure that the tissue can maintain itself and repair itself throughout our life. And this is the first picture of a muscle stem cell. And you can see here, this is a beautiful electron microscopy picture. In 1961, Alexander Mauro, for the first time, imaged the muscle stem cells. And this is, you can see here, this is a myofiber, so the mature muscle, and this is the muscle stem cell on top of it. What is remarkable is that without having all the tools that we have today, genetic and molecular tools, he already predicted that these cells had the purpose of actually repairing the tissue if there was an injury. So it was a remarkable vision of what he was observing. And indeed, it turned out to be true. These cells are essential for actually maintaining and repairing our tissues. And here you can see the cycle of the muscle stem cells, right? So this is a cartoon, this is a myofiber, and this is a muscle stem cells. Most of our life, muscle stem cells are in a sleeping mode. So they're not doing much. They're there, but with their antenna up, ready to sense signals, on danger signals, if there is an injury of the tissue. When that happens, if there is an injury, they start dividing, so generating more copies of themselves, you can see here. And these cells ultimately will repair the damaged myofibers. And then ultimately, some of these muscle stem cells will reacquire this sleeping mode. So they might be ready for the next round of injury or stressors. And so this is a process that continues throughout our life and is quite efficient. And an example is shown here. This is done in mice. And you can see here, if you induce an acute injury, like at day 0, induce a physical injury to the muscle, at early time points, after only a few days, you can see this is a section of the muscle that the myofibers, these are pink round that you can see here, they're quite small at the beginning. But after the repair is complete, they reacquire their normal size and the architecture of the muscle is completely restored. So this really indicates that this process is quite efficient, and this is due to the presence of muscle stem cells in our bodies. And however, during aging, this process is compromised. Now, here I put again this example because we need to think about what happens when a cell divides. When a cell divides, it needs to make a choice of what it will become, whether it will generate one other copy of itself, and this is called self-renewal, or whether it will generate more mature cells and this differentiation. And so then repair like the damaged tissue. And the balance between these choices is quite important to ensure that the repair is efficient. What we see in aged muscle stem cell is that this balance is compromised. So aged muscle stem cell exhibited defects in proliferation, so they divide less, they generate less copies of themselves. They are biased towards differentiation, so they tend to differentiate faster, and over time is going to result in a reduction in the number of muscle stem cells that we have in our tissues. Or they can also undergo a process of cellular senescence, which is a process essentially where the cell ceases to actually exert its normal function, but it persists in the tissue and might have deleterious effect in the tissue as well. So that's another process that is present in several tissues during aging, like the accumulation of senescent cells. So if we think about how they act and how they repair itself, one thing that is important to know is that these cells don't exist in a vacuum in our tissues. So here is a cartoon, and you can see a muscle stem cells, and you can see that it's exposed to a variety of signals in the tissue. And these are soluble signals or signals that might come by the neighboring cells, or also contacting like the cells that is neighboring to it. And so based on the signals to which the cells are exposed to, that's going to impact the decision-making process of what to become when the cell divides. And importantly, during aging, we know more and more now with more advanced tools to study the composition of the tissue, that the composition of these signals is changing. So aged muscle stem cells now are exposed to a different environment, and so they receive different signals, and that contributes to their impaired tissue repair function. From a timing point of view, if we think about how a tissue repair occurs, so if we have an injury, the first thing that happens to a tissue is inflammation. So we have an influx of inflammatory cells coming from the bloodstream, and they're going there to clear the debris, the dead cells, and to provide factors also to stimulate the repair of the tissue. After this, you have proliferation, so increasing numbers of fibroblasts, which are cells that are present in all of our tissues and are quite important to communicate and provide additional signals to muscle cells. And then ultimately you have the activation of muscle stem cells that will repair the tissue. This is an extremely coordinated process. Now, what we see in aging is that not only the composition of the environment is changing, but also these dynamics are altered. For example, we have an increased inflammation in our tissue already. And so these already like deregulate this process. And we also have accumulation of fibroblast cells. And so over time, what you see is that the dynamic and so well-regulated process of repair becomes impaired. And that results, of course, in an inability to repair our tissue that instead of making new muscle is going to make a scar, like it happens if we have large injury to our skin, is going to make a scar to seal basically that area. So the question is that can we actually promote tissue repair in aging, having this information? And so one approach is promoting the way that the cells respond to these signals. And so I'm just going to show an example here of what we have done, but there are many others that are being pursued. And in this case, we actually focus on STAT3. STAT3 is a molecule inside muscle stem cells that respond to inflammatory signal. Again, I mentioned that during aging, we have elevated inflammation. So we have persistent inflammatory signal coming in. And so we know that this molecule promotes the differentiation of the cells. And so we ask, can we actually transiently inhibit this signal? And so basically bias the cells toward expanding. And then after we remove these inhibitors, these cells will be able to make more muscle because they had the expansion phase they were actually providing. And indeed, this is the case. So we have done it in both young and aged mice. So we induce an injury. And then when we treat with the STAT3 inhibitors, what you can see here is that muscle stem cells are more proliferative. EDU is a marker of proliferation in this case, so they're dividing more. And if we look at the muscles, and this is just a cross-section of a muscle, you can see that both in young and aged muscles, the fibers, when we treat the mice with the STAT3 inhibitor, are larger, indicating that the tissue repair is actually more efficient and is happening faster in this context. And this is measured here. You can see the cross-sectional area of each fiber, so you can see that is actually higher when you treat with STAT3 inhibitors. Now, we've validated these findings in human cells. And of course, now we are interested, of course, in keep moving it. It takes significant time to move from clinical studies then to clinical studies. But this is just one approach in which you can modulate the way the cells are sensing the signals that the aberrant, the abnormal signal that presence in an aged muscle. And so we can either modulate how the cells respond to these signals, or we can modulate the levels, trying to block some of these signals that are accumulating in aged muscle. And so this is an interesting approach to us that actually may lead to having muscle stem cell, like promoting tissue repair and counteracting muscle loss during aging. But thinking more broadly, in terms of muscle stem cells, but this is in general for stem cell biology, regenerative medicine, what can we do with these cells? I mean, how can they be utilized as a tool for therapies, right? I show you an example in which you can utilize a drug or a compound, so you can stimulate muscle stem cell in the tissue. So you just basically take a drug and then stimulate muscle stem cell mediated tissue repair. Another approach is to isolate muscle stem cell from the muscle and then expand them in a dish. And then at this point, you can do several things. You can either utilize them for drug screening, so to study how they respond to specific drugs and to identify interventions that can maintain their ability to repair the tissue. And really, ultimately, the long-term goal would be like the ability for us to expand significantly these cells to reach significant numbers and then transplant them to make new tissues. We are a long way from this because we still don't fully understand how to expand the cells in vitro while maintaining their function. And also when we transplant in muscles, the cells don't migrate that much. So it's difficult to really be efficient in the transplantation. But you can think, for example, if you have a trauma, and so you have significant muscle loss, this approach would be very important to reconstruct part of the tissue that is lost. So there is significant interest in trying to devise approaches that can actually reform a region of the muscle that has been lost. And so I mentioned several examples of how of the studies in which you can intervene to ameliorate sarcopenia, either promote muscle growth or antagonize muscle atrophy, or actually promote muscle stem cell function and tissue repair. These are studies that are being pursued. There are again, some in clinical trials, some a little earlier, but they're still like under development. So then the main question is that what can we do now? Can we do anything to maintain our muscles? And I'm sure that you already know the answer to that, but the main way to take care of our muscle is to use them, is to exercise. And so exercise is fundamental for maintaining muscle mass. Again, you see when you are not moving for some time and your muscle mass goes down, it gets reduced. And exercise is an extremely healthy lifestyle, not just for muscle tissue, but for many of other tissues like the cardiovascular system, the brain, the skin, the metabolism is really a healthy lifestyle that we have. And so what is being studied now in clinical trials is what is the best way of exercise, that actually the most effective way of exercise to counteract sarcopenia. And so there is evidence that resistance exercise, like for example, using dumbbells and having like raising weight or having resistance bands for our legs are actually important for maintaining like a building muscle mass. But also endurance exercise like running, swimming, and cycling, but also like even just walking for a significant for an amount of time per day is actually beneficial. So really like that's the main take-home message is really like to utilizing our muscles and exercise and to avoid to lose muscle mass in age context. And the way that it's envisioned, like one approach that is being envisioned in the future is most likely a combination of therapies like exercise in addition to nutritional supplements or in addition to some drug interventions. And another area that is being also studied is the use of exercise mimetics. So trying to understand what are the factors that exercise produce, the molecules that are produced when we exercise, and can we utilize those to promote like again, maintenance of muscle mass. So this is just to give you an overall vision of what happens to our muscle and what are the approaches that are being pursued. And I think I will stop here and I'll just thank all the people in my lab or collaborators and funding, and I'll be happy to take questions. Thank you.
Thank you so much, Alessandra. Good to hear that my exercise might be paying off as I'm getting older. I did it this morning and I must admit I was not excited to do exercise, but clearly there is a purpose for that. So we do have some questions. And the first one I'd like to read is, does telomere length in muscle cells affect or correlate with muscle aging and sarcopenia? And can you explain the telomere length, just so we all know what we're talking about?
Yeah, sure. Thank you for the question. So our DNA is organized in chromosomes, right? Well, from here we have several chromosomes, right? And at the end of each chromosomes, there are regions of the DNA, and they're called telomeres, which are basically region of the chromosome at the edge that are repetitions, and they protect the integrity of the chromosomes, basically, through a combination of interaction with proteins, but they protect. So what is known in terms of several degenerative diseases and also in the muscle, for example, in muscular dystrophies, is that progressively there is a shortening of the telomeres in muscle cells. And so shortening of the telomeres over time means that this protective end is no longer there. And so progressively, this is going to lead to DNA damage, and is going to lead also like to progressive like damage that is present in these cells. And so, and this is because the ability to maintain these telomeres is actually not as strong in adult tissues, right? It's very active during development, but it's less strong in active. Now, during aging, is actually, there have been studies trying to correlate the telomere length with aging and sarcopenia. I mean, there is some evidence that actually telomere shortening correlates with sarcopenia in some clinical studies, but overall, I think one thing that will be important as we move forward is trying to refine these assays, right? Because whenever we do like we measure telomere length, like the average telomere length in the whole tissues. We don't have like a clear understanding of the distribution of the telomere length per cell. I think that now with more and more studies at the single cell level, we can gain more information and trying to understand whether the cells that have the shorter telomeres are the ones that are more compromised in age tissues and moving forward. This is an important aspect, and it's also an indicator that is being monitored for clinical trials. Does some form of exercise, like for example, maintain telomere length? So thank you for the question. So this is an active area of study. Yeah.
Thank you. And another question is, do OTC inflammatories like Tylenol or Aleve help reduce inflammation?
So, well, the disclaimer is that I'm not an MD, I'm a biologist. So let's just be
clear about that. Exactly, that's perfect, yes.
Yeah. So anti-inflammatories do, I mean, several types of anti-inflammatories do reduce inflammation. However, we need to be careful about the effect that the anti-inflammatory cells, the anti-inflammatory drugs have on muscle cells directly. So whenever we take a drug, that drug is going to actually go in all of our cell types, in all our tissues. And so while it might reduce inflammation, some type of anti-inflammatories might have also like some side effects on muscle cells per se. So it is being studied, like again, blocking like major like inflammatory pathway, like the TNF-alpha blockers, for example. But in some cases, some anti-inflammatory might also like modify like other type of stress in the tissue. And so it's important to actually, I mean, of course, talk to your doctor about which type to take, but so that's something always to keep in mind. It's not just only one dimension with a drug, but also to think about the overall impact on the whole tissue. Yeah.
Thank you for that. And one of the questions, you mentioned supplements earlier as an option to help with that. And are there any supplements or vitamins that have clinical proof that they help with muscle?
Well, there are trials. I mean, and there have been several studies, clinical studies and active clinical trials now, mostly focusing on vitamin D, because the level of vitamin D go down also very early. And so taking supplementary vitamin D is actually helpful for a variety of things. That's also beneficial for bone, and is also beneficial for muscle because it promotes muscle growth. And while like the final results on the trials are still not there in terms of the level of dosage and like the type of regimen, I would say that again, in general, taking vitamins for that we know that go down with aging is actually beneficial. So vitamin D is one example. Another example that is being explored is vitamin E, that actually has antioxidant properties, and so in a way might reduce the type of damage like that we have in our tissues. So these are others that are actually being explored. Yeah.
Interesting. I'm glad that there's more trials coming for that too, because it's such a huge market and there's so much advertising around supplements and vitamins, but not a lot is clear yet. And it's nice to see that people are looking into that. And as always, you know, like Alessandra said, she's not an MD. So before taking any supplements, check with your doctor. That's very important, because we don't know what medications you might take and how that might interact. So please always check with your doctor before.
Yeah.
And then we have a question, do any of the avenues you use in your research in muscle regeneration mimic those found in animals? You know, because lizards and geckos can regrow limbs. So is that one you think we'll have to face one day?
So this is an excellent question, because lizards and amphibians are fascinating animals that have this ability to reform entire structure of their bodies. And we envy them because we lost that, evolutionarily, we lost that ability to do that. And so it's very interesting to study how does that happen, and some of the processes shared. And indeed it is true, because during the formation of the limb, for example, in lizards or in newts, several of the signals that are actually present there are the same signal that are present during adult tissue regeneration. So you might find the same the same growth factors. You might find the same ability, the same way that the cells then divide and reform the tissue. So what we have lost as we moved away from the amphibian is the ability to do more, what is called morphogenesis, or rebuild the full structure. We can repair small regions of our tissues, but we cannot rebuild the whole architecture. So that's something that we have lost. But many of the signals are the same. So yes.
Maybe we can get there again.
Yeah.
That would be another superpower. I like it. In some severe chronic illnesses, such as cancer, muscles seem to waste away. What is the biological basis for that, and can it be avoided?
Yeah, thank you for that. And that's a major aspect, because as I said, in some type of cancer, muscle wasting is a contributing factor then to mortality. So it's not the cancer per se only, but it's also the loss of muscle mass. And so for some type of cancer, what has been shown is that the cancer per se secrete factors that promotes muscle wasting. And so one example is chronic level of interleukin-6 that are very, very high. And that leads progressively then to muscle atrophy and to lose our tissue. Sometimes it's not direct production from cancer cell, but is the effect that cancer cells might have on the liver or other tissues. But the endpoint is always producing like the appearance of signals that are promoting muscle wasting. So can it be avoided? I mean, definitely. I mean, some cancer are more prone to cachexia, so muscle wasting, than others. And so it's quite important to monitor early, basically, if there are changes basically in muscle mass, and trying to counteract those signals like through specific like compounds and drugs, and exercise, again, also in that case, trying to promote that, because that's going to complicate then the scenario afterwards otherwise. Yeah.
And we normally just do Q&As through the Q&A function. But we have someone here who has raised the hand. I assume they're having some issues with typing in the question. So Ed, I'm gonna allow you to speak. Hopefully if you unmute yourself, then you should be able to ask your question.
How important is stretching and body massage?
Oh, okay, so that's an interesting question. So in terms of stretching, so stretching, I mean, it's useful for the muscle because again, it promotes the elongation of the muscle, and it's also a healthy procedure to avoid injuries when you run, right? For example, when you do exercise. And so it is beneficial in the way that actually then if you actually do an activity, you have less injury because you are preparing your muscle to activity. So that is important. In terms of body massage, I'm not that familiar like with that as an approach like for aging, but I can think about, for example, in some cases, you also might have, given that the composition of the muscle is changing, you might have alteration in contractions, right? You might have cramps that are forming or something. So it might be beneficial for that, but not overall like to maintain sarcopenia, but to alter sarcopenia. But the stretching is important because again, you want to, every time we use our tissues, we are susceptible to damage. So we also need to be careful, like with everything, right? We need to be balanced. So we cannot do, if we're never trained, we cannot do a marathon because we're gonna have extensive damage to our muscles because we're not prepared to do that. And so being able to have a regimen that is like personalized regimen that is appropriate is actually ensure maintenance of muscle mass and minimize the damage during exercise. That is important as well. Yeah.
I've got a question. You mentioned that the importance of the balance of the stem cells that decide to either become stem cells or become specialized stem cells. Is there a way with in vitro or others that we can just give the body more stem cells in general and just keep that level up so we have less problems? Would that be something for the future?
Yeah, thank you for that. So I mentioned like that, I mean, one approach is to try to isolate them and expand them, right? But we don't fully understand how to expand them in vitro because we don't know the proper signals. Another approach to generate adult stem cells is to start from embryonic-like cells, but not from the embryo. Now, I mean, I think most of us are familiar. We can take any cells from our body, and then we can like make them become embryonic-like. And then from that, rederive the cell type that we're interested in. And these approaches have been done for muscle as well. And so we're able to expand them. The issues there is that we still, the current protocol tend to generate embryonic-like cells, not adult cells. And so the function is actually slightly different. But that is an ideal approach in the long run. If we are able to generate these large numbers, then you can envision a cell-based therapy that we can actually be beneficial for patients. Yes.
Yeah, interesting. There's a question, as we age, is there a point where endurance exercise, especially running, causes more muscle breakdown than benefit?
I would answer to that that's individual. It really like has to do with the level of training and activity of the muscle that you have, right? I don't think it's possible to give a general answer for everyone, but you are absolutely right. I mean, if you do endurance exercise, like for a long time out of the blue, that's going to lead to damage. And how do you know that there is damage? I mean, the first thing that you're going to notice is muscle soreness. That's the first indication that you're having damage. And then more stringent ways to measure muscle damage is to measure muscle force. You're going to notice that you are less strong because you are having damage of the muscle. And then you're going to have inflammation, of course, and all the process that comes with it. So I think that it's important when you actually have your activity to actually develop it gradually and try to not overdo it, because that might be counteractive at that point. Yeah.
Yeah, I think I noticed that a lot when you know, at the first of the year when everybody starts running to the gym because it's a New Year's resolution, and you see people hitting the machines very hard. And I always wonder, like, maybe you should start off a little bit slower.
That's true, because it does happen. And then, of course, that's damaging because then your repair is not as efficient. So you're adding a problem to the problem. So yes, yeah.
Yeah. And you mentioned the benefit of exercise, right? On the muscles and on the strengths of them. But does it do anything to the stem cells themselves, or is it more to the muscle fiber that it really is more helpful?
Oh, that's a great question. So it is, so most of the exercise studies are focusing on the muscle fibers, right? And are focusing on the strength, like the proper strength generation. Now it's coming that actually with exercise, you do, again, the tissue is starting to produce factors. And these factors have an effect also on muscle stem cells, right? So if there are micro injuries, first of all, you are engaging stem cells now to actively repair. You're getting them out of the sleeping mode and they're repairing the muscle. But it also like they are producing factors that there is some evidence that they might be beneficial to stem cell as well. So, and this is just thinking about like the signals, right? The chemical signal. Another thing that is important is the mechanical signal as well. Because our cells, especially in a contractile tissue like muscles, can sense the mechanical stimuli. And muscle stem cells are also sensing the stiffness of the tissue and how soft or how stiff it is and respond to that as well. So you also have that level of signal that is coming with contraction in there. So, yeah.
Yeah. So when we stimulate those stem cells, they help the muscle repair and regenerate, but do they also help the muscle grow or get stronger, or is that not a side effect of?
No. I mean, that's a good point. I mean, it repairs the injury, and you can see in cases where the muscle, for example, if you have a significant, when you have an injury, again, the muscle strength goes down, right? And then it recovers with time. Now, if you have a defect in muscle stem cell, it's not going to come up because the tissue cannot repair itself. If you can stimulate muscle stem cells, the tissue can become stronger, and it can become stronger faster. So you are recovering that. And there are cases also of utilizing stem cell as a tool, for example, in degenerative diseases like muscular dystrophies, where we have a constant damage of the muscle. And that leads to actually, if you stimulate properly muscle stem cells, they repair it and results in increased force. So yes, they do have a contributing like role in increasing also the force of the muscle. So yeah.
I'm wondering, nothing stood out to me glaringly, but do you see any ethical issues in your research that you and your team ponder before moving ahead?
Well, many of the things that we are studying and utilizing, I mean, the ethical issues every time you're trying to intervene, right, is are these drugs, for example, are already FDA approved for a different disease? Of course, that would accelerate the path, right? You don't have to do all the study of toxicity and efficacy. I mean, you can just like move forward a little faster at that point. Yeah. And so ethical issues are always, I mean, you need to move stepwise with a new drug to be able to be sure that it's safe, first of all, and then is also efficacious. From the point of view of stem cells, I mean, there was of course, the significant ethical aspect when 20 years ago, everyone was mainly using embryonic stem cells because we didn't know how to make them, right? I mean, Shinya Yamanaka and John Gurdon still haven't got the Nobel Prize to actually, you know, figure out how to do that. So that had significant ethical implications. Now that ethical implication is no longer there because we only work with adult cells, so that's not there. But in terms of moving forward, it needs to be stepwise. It needs to be done first in cells, then in animal models, and then in human cells, and then moving stepwise. So it's a slow process, but that's to guarantee the safety of patients. So that process is in place for a reason. So yeah.
I'm just wondering, because there is so much discussion about stem cells, not because of the embryonic issue that we were facing at the beginning of this research, but is what we can do with stem cells, right? Because stem cells make up everything. They build the organs, they build our muscles, they build everything we have. And I just wonder if people think about stem cell research as in, you know, we can just modify our bodies in a way that is outside of what humans are supposed to do.
Yeah, I mean, I agree with you that that's a good point. That's a good point because there is always, I mean, there is always someone will always going to think of how to utilize in a very, very peculiar way, like an approach, right? And I agree with you, right? And so, for example, these fundamental studies of, you know, of cellular reprogramming to generate embryonic cells then led to cloning, right? And that's whole other issues, right, at that point. And so in terms of stem cells for regenerating tissues, I see that more in the context of regenerative medicine because it really goes into parts like that we can use to replenish like a part of the tissue that is lost. Now, if you're thinking about, for example, to utilizing it for aesthetic purposes, I've seen all sorts of things. I've seen, examples of, someone that actually had implantation of muscles, abdominal muscle, because he wanted to have like the 8 like packed visible. And it was, to me, that was what. I mean, I'm actually surprised that the doctor did that because I mean that has to do more with body dysmorphia, like a real like a different type of condition of that patient rather than other things. So I agree that even with this, that always should be regulation of utilizing it for health purposes. Yeah.
And I know this is not your area of expertise, but I was wondering if you know anything when you talk about using it for medical and regenerational purposes, and we now can do stem cells from skin. Where are we on making skin sort of in a dish for burn victims?
That's actually has been significantly advanced even before like muscle. That was significant. That was way more advanced. I mean, already, like I think it was a decade ago or even more. There was, it's probably not the only one, but there was a scientist in Italy that started to build sheets of skin. So he's able to make them grow, make sheets, and then basically make from taking cells from their own patient from another region, right? Like grow them and then implant them as flap implant on the burn area. So that has been significantly advanced. Now, if you think about skin, is relatively easy organized if you think about it, right? You can grow it in 2D. The difficulty with 3-dimensional organs is that you need to recreate a different structure. And so that's why there is an area of bioengineering where they're trying to actually generate 3-dimensional organs that actually might allow us to actually do that. Yeah.
And do you think that's going to be the future for muscles too, where when we have a muscle tear, and instead of having to wait 6 months for a professional soccer player or football player for that to heal, we just put them under the knife and just put in a whole new muscle?
Well, I mean, it takes time also to make them in vitro. So I'm pretty sure that it's going to take time for that as well. But I think that depending on the degree of the injury, I mean, in some cases, the larger the injury, the less efficient will be the repair, right? So that's why we're starting having scars at some point. So try, first of all, to prevent that scar from happening, because then after it's created, it's very difficult to remove it. And so that's an important point. And then, I mean, I think that in the future, if we are able to expand them and generate tissue in vitro, I think that that would be beneficial, especially for large type of lesions, not smaller ones, yes.
Well, thank you so much. We're just on time with the talk today. Thank you so much, Alessandra, for joining us today. I really enjoyed the presentation. I learned a lot, which I'm always amazed at. Thank you so much. Thank you so much, everybody, for joining us today. I hope we'll see you at some of the other events that I had listed. We have many more science talks. We have a planetarium show, and hopefully soon we'll be able to see you back at the Fleet Science Center. But until then, don't lose your interest in science, and thank you for supporting us. Thank you, Alessandra.
Thank you so much. It's been great. Thank you, everyone. Bye-bye.
Thank you. Bye. Have a great day. Stay safe.